Hello, I'm Mike Giovingo from Chicago, Illinois, and I'm here at AAO just going to summarize a panel discussion we just had with discussing the MicroPulse Transscleral cyclodiode from IRIDEX. This procedure has truly changed a lot of the ways that I address glaucoma with my patients. We have approximately a 60 to 70% success rate for primary open-angle glaucoma in lowering the pressure. Sustained all the way out to as much as 24 months. It's a non-incisional procedure when performed correctly, has an extremely low inflammatory profile and a very favorable side effect profile. One of the nicest things for me is it takes patients that are either resistant to surgery or would have some type of an issue with follow-up or wanting visual recovery as quickly as possible, and allows them a lower side effect profile procedure that, again, it works at a very high rate of getting the patients down to a good pressure. Traditional cyclophotocoagulation actually destroys tissue and decreases aqueous production. MicroPulse cyclophotocoagulation works in a multifactorial approach from rotating ciliary body and opening up conventional outflow, along with a very mild destruction of the ciliary body. So it hits the glaucoma and the pressure on both sides of aqueous production and aqueous outflow, versus the much more destructive ciliary body procedure of a traditional diode. Once I've gotten to a stage where the patient is progressing despite being on maximally tolerated therapy, I discuss both doing a incisional procedure, whether it be trabeculectomy or a tube shunt, versus a MicroPulse diode. And I presented to the patient as far as I think that one has a higher success rate being the incisional surgery, but does have its complications, risk of inflammation, risk of endophthalmitis, infection, vision loss. And the other one does have a little bit of a lower success rate, being somewhere around 60% depending on the study, but does have a much better safety profile, does have a easier recovery and return back to their baseline vision.